Welcome back, viewers, to Faith and Discipline podcast. Our guest today is Dr. Usman Javed. He's a dentist. Welcome, Dr. Javed, to Faith and Discipline podcast.
Thank you very much. Thank you for inviting me.
Oral hygiene, that's the topic for today, is most neglected. What happens if we don't look after our teeth?
That's a very good question. Oral health, I would say, is a very crucial part. Is if you do not look after your teeth, you can affect your whole body. If you don't clean your teeth, if you do not look after your gums, you can not just lose your teeth, or you're not just going to get the pain or discoloration, but actually you're going to get other problems like stomach problems. You can get like diabetes, heart issues. It could cause very serious issues if you ignore dental health.
These are the issues you just mentioned. These are quite serious. But people have not got the awareness, like due to bad oral hygiene, they can suffer from these issues. So how do you educate people so they can clean their mouth, they look after the teeth and oral hygiene?
So basically, and generally, we the education dental of oral health starts from the school. The system in the UK especially is parents. We start educating parents and then children to brush their teeth, and obviously we advise the parents to bring their children to the dentist as soon as they get first tooth. So the education starts when we advise the patients' parents, the children's parents, how to brush their teeth, how to clean, look after the oral health in general, not just the teeth, but actually the gums and the tongue as well. And there's lots of material on social media and on the general media as well about this, how to clean their teeth and this awareness.
On that topic, there are a lot of information on social media and internet which can be misleading, which can be incorrect. So people have to be very careful who to follow. Only go to sources which are authentic and give you the right information. What is the difference between tartar and plaque?
Plaque is basically the initial stage of the tartar. Plaque is a soft layer of bacteria mainly on your teeth, and it comes again straight after, like maybe about after 30 minutes to an hour after you brush your teeth. It can be there all the time, and you can rub it off nice and easily with the brush and with the floss. But on the other hand, tartar is, if you leave the plaque for a long time, it mineralizes, it calcifies, and it becomes into tartar and hard to remove with the brush or with any, like at home, easily. So you have to go to the dentist to remove the tartar, and it could cause serious issues as well, especially like gum disease and advanced stages.
Yeah, that was what I was going to ask. Most of the people, they're only aware of the tooth decays and those issues. They are not aware of the gum disease. So what is gum disease?
So gum disease is basically weak gums, inflamed gums, especially if you don't look after your teeth, you don't brush your teeth. So what happens is bacteria accumulates around your gums. So it makes a layer which decreases the oxygen and the blood supply of the gums. So in result, bacteria niches in there and does its job, in consequence makes it weaker, and gums leaves the tooth into loose state. So in result, you'll have loose teeth and bleeding gums, and the smell is a result of that as well, and it could cause other serious issues as well.
Okay, because it can lead to bacteria can go deep down in, and definitely. It can definitely in your bloodstream.
Yeah.
Some people, unfortunately, they have bad breath. Mm-hmm. What is your advice? How can they fix the problem?
So on the bad breath, I would say first of all, start brushing your teeth. Mm-hmm. There's other reasons as well, apart from not looking after your teeth. First, I'm going to focus on the hygiene, oral hygiene, and then I'm going to briefly tell you about that as well. First, if you do not look after your teeth, so what's going to happen is bacteria will be there and they break the food, and as a result, the gas is released. That is the reason for the bad breath. So if you do not look after your teeth clean, you will have the bad breath. and you'll have to suffer with that. It's obviously when you talk to someone and your mouth smells, it's humiliating as well. And then it could cause, if you do not look after your teeth, the other reason of the bad breath, it could be your gastric issues. If you digestion issues, then you could get burping issue, and that could cause the bad breath as well.
Okay, fine. How do you advise patient treat it other than oral hygiene?
If you have a gum issue, then I would suggest to go to the dentist and get that cause treated. If there is any other issues, or even you do not know what's the issue, you could go to your dentist, and dentist will advise. If it's not the gum issues or any oral issues, the dentist will advise you to go to the GP, or will refer you to the GP, or wherever is the best option for you.
Okay. It starts with the food we eat. Which foods are worse for our teeth?
So, first of all, sugary foods, plus sugary and sticky. For example, gummy sweets, and then biscuits. They stick to your teeth, and they stay there for a long time and cause bacteria to play their game and cause the caries and the gum disease and everything. So apart from that, there are other foods like fizzy drinks, soft drinks. These are acidic in nature, so they can cause very eruptive enamel loss, the tooth surface loss. So that's another issue. And then alcohol and beverages, and then you have to drink tea and coffee carefully, because they could discolor your teeth as well. Any acidic drink, people do take orange juice, and these juices that is very good for you. But I would say, if you wanna take some juice, rather take original fruit, because fruit has fibers and other things as well. But the juice is just squeezed into it's a sugary fluid now. So it's not very good for your oral health. And when you drink one glass of any sugary drink, the teeth stay acidic in nature for hours, and the bacteria affects more on in acidic nature environment. So stick to, if you want to snack on the nuts and cheese, something which is sugar-free as well. Chew sugar-free gums as well. These are the things I would advise.
Okay. So to clean the teeth, what is your recommendation? What is the best way? Because everyone cleans their teeth. I would say majority of people, but they don't know exactly how to do it. Maybe they are missing out.
That's a very good question. My principal used to say, if you could give someone to, as a dentist, you could give something to someone, that is how to clean your teeth. So I'm going to tell you, it's a bit long question. So first of all, brushing. Choose the best brush. That's first important thing. Smaller head, I would recommend on the brush, smaller bristles, and then soft in nature. You can use up to medium, but try avoiding the hard bristles, because they can hurt your gums, and then obviously if you hurt your gum are very delicate in nature, so if you use a hard brush, that can hurt and damage your gums as well. Secondly, brush twice a day minimum. That's one time is just before going to bed, nothing after brushing. So use fluoridated toothpaste, 1400 to 1500. That's the maximum advice for a normal person. Those are fluoride per part per million. And then the other time, it could be in the morning after breakfast, or even before breakfast. That's okay. Basically, you're providing fluoride in your teeth. But the night time is very important time. Secondly, you brush your teeth. When you brush your teeth, hold the brush facing towards the gums, angle 45 degrees, I would say. So face it, and then you're gonna choose 2-3 teeth at a time, and you're gonna start vibrating, not just rigorously, not rubbing, not like this, just vibrating. So you're doing circular kind of motion, and do about 15 to 20 times vibrations on one segment, like 2 to 3 teeth. And then when you're gonna do it outer side, then you're gonna do it from inner side, and then do not forget the biting surfaces. Then move on to the other teeth. I would say start from one side, right top teeth, go to the left, go to the bottom and finish on the lower right. Yeah. And then mouthwash. Mouthwash, you have to be careful using that. Do not let children under 8 years of or old age children, do not let them use mouthwash. Use that a separate time than the toothbrush. Do not use same time because it affects the fluoride concentration with each other. And you can get any normal mouthwash from any superstore or any shop. Do not use the chlorhexidine in a normal routine because they could discolor your teeth. Third thing is dental floss. It's like a thread. You can use it around your fingers and use it. It's very good to use clean like in the middle of the teeth. And then at the end, you should clean your tongue as well with the brush. You can use it with the brush, or you can get a tongue cleaner separately. It's your personal choice, but you should clean that as well.
That was actually my next question. Is it only the teeth that which are important for us to be looked at, or is it tongue and gum? How can we look after them?
So gum, as I told, the technique of cleaning the teeth, I told you, it includes with the gums. So when you facing angle, when you give the angle to the brush towards the gums, it's basically cleaning the gums as well, softly, gently vibrating around it. So you gotta have to clean your gums because that has to be clean. And when you do that, clean your when you brush your gums, it increases the blood supply of the gum as well. Plus, at the end, you have to clean your tongue because the bacteria can stay on the tongue as well, and the same thing again. And same with the gums as well. You have to make sure the gums are clean.
For children, at what age do they need to start brushing?
That's a very important question. Children, from the time they get the first tooth, parents should start cleaning their teeth. It's not until they get the permanent teeth or just the milk teeth, all the teeth. It has to be from the first tooth because obviously tooth is there, so you have to clean it out. So with the first tooth, you can get a small baby toothbrush from the superstores now, or you can use a wet cloth, just clean it. And when as they grow up, they get more teeth. You can start using brush. Use soft brush, and just make sure we keep clean their teeth clean as well.
I know you just mentioned the advantages of using mouthwash, but there are some disadvantages.
Definitely.
So what are the disadvantages?
As I mentioned briefly, that if you do not use them properly, you can discolor your teeth. If you swallow them, they could cause digestive issues as well, because it is quite concentrated and has fluoride in big concentration. So if you swallow, then it could be an issue. But mainly it's the discoloration which is the issue, especially mouthwashes containing chlorhexidine. They usually be advised from the dentist. But if some people can pick up from the supermarket and they can use them, if you do not, if you keep using them for more than advised time, they could cause the discoloration. Sometimes it is temporary discoloration, but it could go. If you do not stop, then it could be permanent as well.
As we know, like we have bacteria all over our body, on our skin, in our mouth, everywhere. So, when we take, for example, antibiotics, it kills all the bacteria, healthy and unhealthy, yes. All of it. Similarly, when we use mouthwash quite regularly and rigorously, I believe it can kill all the healthy bacteria.
Yeah, basically, in the mouth, we have to clean all the bacteria, but if you use too much, there are some very strong mouthwashes as well. They could do that. Normal mouthwashes, they don't do that. But if you use it too much, then it could be an issue.
I believe the non-alcoholic one is better option. Is that right?
Yeah, I would suggest non-alcoholic and just the normal any fluoridated mouthwash.
Yeah.
You can buy it from supermarket. They normally are cheaper than the chlorhexidine or any special ones. So I would suggest stick to them.
You know, in some societies, they have like certain habits. It's more like cultural thing. They either chew tobacco, betel nut. It's like a nut, really hard shelled. And another thing is called pan.
Yeah.
That is a betel nut leaf with some ingredients inside, especially in the Indian subcontinent. So, what are the risks involved?
That's another important question. Betel nut, pans, tobacco, these all things are very dangerous for especially oral health. They can, apart from breaking your teeth, discoloration and all these small, they are smaller issues as compared to what they actually can do. They basically, the maximum, the worst thing is they could cause cancer, especially chewing tobacco and betel nut. They are one of the worst things you could have, and especially in our continent. You see lots of patients doing these things, and people don't even know that the problem has come to this point now that you cannot treat it. So I've seen people with very bad condition. These are a very big risk factor to the cancer. Forget about any pain, any discoloration, breaking teeth, or gum disease. All these are part of it, but that I would say the cancer would prove the thing that is the major issue you can get.
What are the effects of smoking cigarettes or vapes on our oral health?
Okay. Smoking cigarette and vapes, they basically, first thing they do is discolor your teeth. Secondly, what they do is they decrease your saliva flow in your mouth. So what that does, saliva is basically a very important thing for your oral health. What it does is cleans your teeth. It has antibacterial effects on the oral environment. And then it could be when you smoke too much, then why reduces the saliva flow, which helps bacteria to grow up more. And then obviously bacteria is growing more and the blood supply of the gums is decreased as well because of the smoking. So that all these factors could cause decays, tooth decay, gum disease. It affects diabetes as well. It could cause your heart issues apart from these. So smoking and vaping both are very bad things for oral health.
Okay. Link between oral health and diabetes.
Diabetes and oral health. Very important question. Diabetes, if you do not look after your oral health, you can affect your diabetes. It can be uncontrolled, especially with the gum disease. You'll see many people with diabetes will have the gum disease because it's either they don't look after much their teeth. The people do not look after they will have definitely the problem. So what happens is if the blood supply will be affected because the sugar is too much in the blood, obviously, and then this will cause definitely the gum disease, and not just the gum disease. Actually, it will be the advanced periodontal problem, which can wear off your bone in your teeth and under the gums, and which in result losing your teeth, and you could lose your teeth as well.
Yeah. And people with diabetes, they also have like dry mouth issues.
Yes, definitely. That is another factor. If you have diabetes in not controlled, then you will have dry mouth, and which that will cause decay and the gum disease. All these things again.
Lack of saliva.
Yeah,
another problem.
That's it.
Any final words on oral hygiene? How a general public can look after their oral hygiene?
Very good question. First thing, most important thing is brush your teeth twice. Some people in our culture, especially Asian culture, Muslim community as well, they use miswak. If some say that, okay, I'm doing miswak and it's enough. According to Hadith, Rasulullah Sallallahu Alaihi Wasallam used to miswak 5 times a day minimum. Every time he would do wuzu, he would use the miswak. Miswak is a very good thing. There's no question on that. But if you use miswak, you'll have to use it that many times because with miswak, it's very hard to get into all the parts of the teeth. So basically, toothbrush is an advanced form of the miswak as well. So you can use that. It's like I always give the example of the time. So Rasulullah time people would pray namaz according to looking at the sun and moon and the time, light, basically. So now we got the clocks. Nobody looks at the sun. So this is same is with the toothbrush as well. So I would say toothbrush are easier to use. Use the miswak for sunnah. That's fine. I would advise that. But use the toothbrush which is suitable for you, and make sure you brush twice a day minimum, especially at night time. That is very important time to brush your teeth. I'll give you another example. We use china plates. Let's say we ate food at night time and we got two plates. One we washed it there and then, and the other one we left it for the morning. So which one will be easier to wash? Was the one we had just food? That will be very easier to wash, and we left in the morning, that will be greasy and it will be hard to wash in the morning. So rather brush your teeth at night time instead of doing it in the morning, waiting for the morning. So, and then obviously at that time bacteria will have the time to damage your gums and the teeth as well. This is I would say. And there's another hadith I want to mention. Rasulullah sallallahu alaihi wasallam said, if I wasn't scared to put my ummah in trouble, I would make two things very important for them. First for them, using miswak with every time wuzu, and then second thing is praying Isha later. So the miswak is that important that he wanted to make people use it, because he knew that it could cause so many problems, so many major health issues, including cancer as well, if you do not look after your teeth.
For our viewers, miswak, who don't know what miswak is like a twig or a small tree branch, which is quite soft bristles, which we can use. And it was used like 1400 years ago, and Muslims carry on using it. But as you said, the times has changed. At that time, people didn't have the gummy sweets and and the sodas and the coffee and things like that. But now, food has changed, so they need to change as well and start using the brush. Many thanks, Dr. Javed, for your time. I believe the information provided, our viewers will find it very useful.
Thank you very much.
Many thanks for watching this episode, viewers. If you found this useful, you can share with family and friends. If you haven't already, please make sure to subscribe to this channel. Thanks for watching.